Welcome to the Defeating Epilepsy Foundation YouTube channel. In this presentation, we will discuss what Rett syndrome is, its genetics, signs and stages of Rett syndrome and epilepsy, similar conditions, and treatment and management. Make sure to like our videos and subscribe to our YouTube channel. Click on the bell to be notified of future videos. Please click on our donate link in the description section below and donate today. Your donation helps us to make a difference for those battling epilepsy. We appreciate your support. Rett syndrome is a rare neurological disorder that negatively affects intellectual, speech, and motor development. Rett syndrome is primarily caused by a genetic mutation of the MECP2 gene. The MECP2 gene encodes for a protein necessary for the proper development of the brain. When there is mutation of the MECP2 gene, this can result in developmental delays. Those with Rett rarely inherit the mutation from their parents. It usually occurs spontaneously in children. Rett syndrome is X-linked dominant and seen primarily in females. It occurs in 1 in every 10 to 15,000 girls. The MECP2 gene is found on the X chromosome. Females have 2 copies of the MECP2 gene and males have 1 copy. Females with Rett will typically have 1 mutated gene and 1 normal gene. Rett is rarely seen in males. Since they only have 1 copy of the gene, a mutated copy of that gene usually means the child is unable to develop properly and has a very low chance of survival. Children with Rett syndrome develop normally for the first 6 months of their lives. Then they will start to show symptoms of delayed development. These symptoms are grouped into 4 stages. These stages are not rigged. Stages can overlap, and some kids may only show a few of these symptoms. Stage 1, 6 to 18 months early onset. The following symptoms are seen in stage 1. Low muscle tone, reduced interest in toys, loss of eye contact, difficulty sitting, crawling, or walking, slow head growth. Stage 2, 1 to 4 years of age regression. The following symptoms are seen in stage 2. Decline in speech and intellectual ability, loss of muscle coordination and hand use, social withdrawal, repetitive hand movements like hand wringing, hand washing, clapping, tapping, or hand mouthing, irregular breathing, problems sleeping, irritability, screaming, and crying fits. Stage 3, 2 to 10 years of age. The following symptoms are seen in stage 3. Improvement in eye contact, social interactions and behavior, stiff muscles, teeth grinding, and seizures. Stage 4, deterioration of movement. The following symptoms are seen in stage 4. No change in intellectual, cognitive ability, or social communication skills, loss of mobility and inability to walk, muscle weakness, scoliosis. Seizures are a very common symptom of Rett syndrome. Those with Rett syndrome can have all seizure types. However, complex partial, generalized tonic-clonic, tonic, and myoclonic seizures are more common than clonic or absent seizures. The symptoms of Rett syndrome can resemble those of autism, difficulty making eye contact, social withdrawal, Angelman syndrome, difficulty walking, seizures, decline in speech and intellectual ability, stiff muscles, cerebral palsy, seizures, speech delay, loss of muscle coordination, and stiff muscles. There are no cures for Rett syndrome currently. However, it is possible to manage the symptoms with anti-epileptic drugs, vagus nerve stimulation, speech therapy, behavioral therapy, and physical therapy. In 2023, Trofinetide was certified FDA-approved to help manage the symptoms of children 2 years and older. It is currently the only approved pharmaceutical designed to treat Rett syndrome. In conclusion, Rett syndrome is a genetic neurodevelopmental condition that affects primarily young girls. The symptoms of Rett syndrome usually involve motor, speech, and intellectual decline. Intellectual ability does stabilize, but motor functions continue to deteriorate. Seizures are common, but can be managed with anti-epileptic medications or therapies like vagus nerve stimulation. Trofinetide has recently been approved for the treatment of Rett syndrome symptoms, so this gives hope for future medications and therapies for those with Rett syndrome. To learn more about Rett syndrome, please check out the resources used in the presentation today. Please like and subscribe to our YouTube channel and follow us on our social media pages. We would love to hear from you. Leave a comment below or email us at info@defeatingepilepsy.org. Thank you for your support, and together we will defeat epilepsy. Check out our other great videos and subscribe today. You have the power to defeat epilepsy.